One thing that I learned very recently, and it's helped to bolster my fight for dignity for incarcerated women, is the fact that 75% of women who are incarcerated are there because of a mental health disorder. We need to do better. As for our topic this morning, I'm very, encouraged to see so many faces here dealing with the important issues of women's health. And I'll just jump into some of the issues that I've been very, very passionate about, and that's postpartum depression and support for women and infants suffering from that. For more than a year, many of us struggled emotionally as we were all cut off from connecting with our friends and our families, and often even coworkers because of the global pandemic. It was a challenging experience as the news continuously reported updates on COVID-19 deaths combined with information regarding the divisive presidential election. I think it is fair to say that some individuals faced the most stressful collective experience in their lifetimes. Some of us were overwhelmed as our jobs demanded more time than ever before. Others were without work. Many individuals were forced to face a failing unemployment compensation system. Chair of Labor and Industry lived it 24/7. Not a great system for millions of people who desperately needed it. And millions of those people were applying for the first time ever. And it was hard to navigate that antiquated system. Parents were forced to not just be child care providers, but also teachers. Those who had worked their entire lives to invest blood, sweat, and tears into the dreams of owning their own businesses fought valiantly to remain solvent despite the governor's oppressive closures. Many lost the fight, succumbing to the stark reality that their dream was destroyed. They lost their investments, they lost their savings, they lost their future. And I had constituents who lost their lives intentionally because they thought they couldn't make it through the closures. That was devastating for everyone. We all have stories of sobering challenges, either on our own or maybe of those that we love. But take a minute, if you will, and imagine on top of all of that, you became a new mother during the pandemic. Imagine the loss you would feel when you discover that you will not be surrounded by those that you love at your baby shower, in the hospital, or even back at home when you return with your beautiful baby. Those moments that every parent should be able to enjoy were simply torn away. Those precious moments meant to be cherished forever just would not exist. The support and encouragement of others who share in your joy would have been tremendously compromised. All the while, you'd be trying to care for a new baby and simultaneously be dealing with hormones that have gone haywire. It's normal and understandable for women to feel overwhelmed and isolated after giving birth. However, it's not something that we discuss often enough. It has not been normalized, so the stigma is still very threatening to many people. It is confusing to feel so sad at a time when you know you should be so happy. Giving birth during a pandemic magnifies those already powerful feelings. Many women who never dealt with anxiety before were facing real fears about the health of their babies and the rest of their families. It is no wonder that so many new mothers felt overwhelmed and alone. In fact, research from American Psychological Association has shown that pre-pandemic, approximately 15% of new mothers suffered from postpartum depression. In Pennsylvania, this means that more than 20,000 babies and mothers are impacted every single year. No doubt even more women struggled last year due to the pandemic. After the onset of the pandemic, new mothers reporting symptoms of depression rose from 15% to nearly 41% in April and May of 2020. Meanwhile, 72% of moms surveyed experienced moderate to high anxiety, compared to 43% pre-COVID-19. The first few years of life are the most critical for a child's overall health and development. Anything that gets in the way of that process can create serious consequences later on. According to the American Academy of Pediatrics, a baby's brain development can be adversely affected when a mother suffers from perinatal depression. Likewise, there is an increased risk of child abuse and neglect, which can have reverberating lifelong impacts on the child and the family, and which significantly increase the cost and difficulty of providing services and medical care to both the baby and the mother over time. Senate Bill 200, which I have sponsored with Senator Judy Schwenk, would add postpartum depression as an at-risk category for early intervention screening and tracking under state law. That means if postpartum depression is detected, at-risk infants are identified and connected to EI far earlier than they would be otherwise. And if they subsequently do demonstrate a developmental delay, they can more quickly and easily be enrolled in early intervention services. My bill would also allow providers across different systems, ranging from pediatrics to adult mental health, do a better job coordinating with one another, with early intervention playing the role as the connector. Current state law provides tracking and services for infants with qualifying health conditions and those who are born into certain circumstances. Some of those are children whose birth weight is under 1,500 grams, children cared for in a neonatal intensive care unit of hospitals, children who are homeless, children born to chemically dependent mothers who are referred by a physician, and those who are seriously abused or neglected, and children with confirmed dangerous levels of lead poisoning. By adding postpartum depression to the list of qualifying conditions, infants and their moms who suffer from this condition will have easier access to the services that are already in place in communities to support healthy child development. Moms and their babies will get seen quickly in an environment focused on both the child and the mother. And early intervention is already in place in all 67 counties of Pennsylvania. This step simply makes sense. This legislation has the support of a number of groups, including Allegheny Health Network's Alexis Joy Dancili Center for, that's hard to say that 3 times, for Prenatal Mental Health, Gateway Health Plan, the Pennsylvania chapter of the American Academy of Pediatrics, NAMI, Keystone, Pennsylvania, Policy Lab at Children's Hospital of Philadelphia, the National Coalition for Maternal Mental Health, the March of Dimes, the University of Pittsburgh's Medical Center, and many, many more. While mothers often feel pressured to meet unhealthy and unrealistic standards of being supermom, women need the support of those around them at home and in their communities. They need to know that programs free from any shame do exist to help them if they're struggling.
You mentioned the percentage of women with mental health needs that are currently incarcerated. That being quite high. All of us here, most of us here are mental health providers for women in the Pittsburgh area and beyond. Can you speak to what's happening in our state, nation that has resulted in the higher frequency, and then also what we can do on the ground to try to change, shift this percentage lower?
That is a great question. And again, I just recently found this out because I had dinner with outgoing retired Secretary of Department of Corrections, Secretary Wetzel. And I knew that there was a very high percentage of mental health challenges for women who are incarcerated. I had no idea it was 75%. No idea. Because, like it or not, women really don't commit crimes on the level of guys, okay? We just don't do that. Especially serious crimes that result in long incarceration. A lot of those women who are incarcerated for a lengthy period of time are women who were sexually or suffered domestic violence. So there's a lot of guilt, there's a lot of remorse, there's a lot of post-traumatic stress issues. I think that one of the things that I'm very, very passionate about, especially having started the first Criminal Justice Reform Caucus, is knowing that there are people behind bars for decades and decades that are there because of a mental health disorder, leading to self-medicating with substance abuse, a dual diagnosis. And in Pennsylvania, for some reason, they don't really like to tie mental health and physical health together. And separating those two out, I think, does a great disservice. And we need to do a lot more to combine those two. But as far as folks who are in the mental health field, things just like postpartum depression, there is such a stigma to it. Women don't want to admit it. They think that they're a failure as a mom if they're not just thrilled and overjoyed and, you know, happy as can be seeing their new baby crying for the 37th time tonight. They need to be supported, and we need to get out there proactively. I think it would be important for every obstetrician to have some kind of mental health training, to at least not just to identify an issue early on, but just to lay it out there and just say, look, this might occur. It could happen before you give birth. It could happen immediately after. It might take a year. Here are some red flags. These are things you need to be aware of so that if it does happen to you, you're not crazy. It's chemical. We can fix that. We can help you. We can walk you through it. There are all kinds of programs, all kinds of groups, all kinds of therapies, treatments, and medications that can make things a lot easier for you. But just to be aware of it and bring it up before there's a huge need, because again, 15% of moms are affected. Those are only the ones that admit it. Those that are in the shadows, it's a much, much greater number. So just to get it out there, I think finally, thankfully, we're removing the stigma of substance abuse disorder, of drug abuse, knowing, look, this is an illness, we need to treat it. This is something that we can overcome and move forward. For some reason, having postpartum depression is more embarrassing for some people than being addicted to heroin. You just need to talk to people. Does that help you? Any other questions?
More here.
Great.
Keep coming in.
Good.
Also, could you speak to what's happening on a state level in terms of funding that is going to assist with sort of targeting some of the mental health needs for women and infants?
Mm-hmm. Well, when I first got the bill sort of across the finish line, not really, they turned it into a pilot program just for Washington County, which is one of the counties I represent. And I thought, well, a pilot program has pretty much been the history of this issue for years, but I digress. So instead of putting decent funding as a line item to address this and really move forward and help, we got, I think it was $250,000, and it was earmarked for this pilot program, and it went through the United Way, but then it went through just the Washington County Human Services Department. Okay, if we need to take baby steps, see what I did there? You do it without knowing, it's a game we play. Take baby steps forward to highlight this issue and really shine a light on it and say, okay, with just a little bit of an investment, the return on that investment is astronomical. And it's not just in the value of life, the relationship between mom and baby, saving lives, preventing suicides from moms who just really can't get over postpartum depression, preventing lifelong issues, that need far more social services than just early intervention. You know, we'll take the, I won't even say a half a loaf, we'll take a slice of bread before, you know, moving forward and hopefully pushing this forward. And right now, my bill is sitting in the in the Health and Human Services Committee in the Senate. And when we get back to session next week, Monday, Tuesday, Wednesday, I will be taking the packet in to the chair of that committee. God bless her, though. She's wonderful. Michelle Brooks, Senator Michelle Brooks is the chair of that. She's fantastic, but she has been suffering really awful results of what she thinks might have been COVID before anybody knew what COVID was. So God bless her for that, but she's really kind of struggling and coming into Harrisburg, a 6-hour drive for her, and then trying not to be around too many people to, you know, I mean, even just catching a cold could be pretty devastating. So, you know, we're all praying for her health and recovery, but we need to get some of these bills out of the committee. So I'll be addressing that next week.
And so one of the questions was, currently early intervention has a significant weight for evaluation and then assignment to agency when they qualify for services. What are your thoughts on how that can be addressed?
You know, I think that is county specific. Allegheny County, as we know, the population is massive. You know, and again, don't forget that there are fewer and fewer medical facilities that provide for birth, you know, for delivery. And it's getting more and more condensed into the higher population areas, Allegheny County, Philadelphia, and things like that. So in our rural areas where they might have an obstetrician, but they're not going to deliver there. So when they get to the delivery room and before they're released from the hospital, they're seen by someone, yeah, but are they really given the information they need? And a lot of these moms at that point in time, just handing them a sheet of paper, oh, here's a list of numbers that you can call if you happen to, no. The intervention needs to happen earlier than that. And discussions need to be had and over and over and over again. It can't just be a one and done. This is something that they need to be aware of. And I would like for every single OBGYN's office to have literature there hanging on the walls, numbers everywhere. Here's the symptom. Do you feel this way? Have you thought of this? Have you, here's a number. Here's a group you can call. But I think we need to take the shame out of it. And to have moms wait when they admit it and when they know that they have a problem, to then make them wait. You know, we've lost a lot of moms because of this. And it's too great a need and it's too important. We need to act on it quickly. So having to be on a waiting list for things is that's excruciating when it comes to mental health in any way, in any shape or form.
And the next question is, can you speak about where the Pregnant Workers Fairness Act stands? This was referred to the Labor and Industry Committee in May. And when might it be brought up for a vote?
I'm chair of Labor and Industry, and I haven't heard of that bill. Whose bill was it?
But we can also find out more.
Well, I mean, that would dovetail very well. Oh, somebody has an answer.
Nadler of New York is introduced as a sponsor of it. Nadler.
Okay, so that's a federal.
Yeah.
That's on the federal level. Okay. Great, but that's very worth looking into. And again, I think that sort of echoes the ideas that I'm pushing for dignity for incarcerated women. I don't know if any of you know this, but women who are incarcerated and they're pregnant, if they're going to labor, they're shackled.
No, they're not.
I can call some folks that this has happened to.
I mean, I'm sure it's happened, but
Yeah, it's not every time, but it happens. There is no law against it. That's the meaning of my legislation. But it has happened, and it does happen. So it doesn't happen every single time, but it certainly does happen, and there is no law against it. This law would also prevent cavity searches for women who are pregnant, and there is no law against that. It would also make sure that women who are incarcerated have a female guard strip search them in matters where that's required. Right now, there is no law against that. So there are issues with incarcerated women. There are also issues with incarcerated women not having access to feminine hygiene products. That's ridiculous. That's absolutely ridiculous. So I'm very encouraged and very happy that it doesn't happen to every single woman who goes into labor, just like a lot of issues don't happen to every single person when you have legislation. The fact that it does happen at all and ever should be prevented. Other questions? Yes?
I have a question. I don't think I need the mic.
Okay. It's a pretty quiet room.
Thank you, first of all, for the work that you do. Much appreciated. My question is, in regards to this bill for the early intervention for the neonates, and when you are specifying postpartum depression, is that the only mental health diagnosis that is going on to this bill? Because I'm worried that that's going to create problems for women who don't quite meet the diagnosis of postpartum depression, but who also have postpartum anxiety or postpartum PTSD, who also fit into this category of, with complications in those early years with the babies and the toddlers.
Yeah.
So do you have language that will allow for that, or is it just specific for depression?
I mean, we're calling it postpartum depression, but it covers the areas of, and it's not only postpartum, it's even, before the baby's born. So it is an umbrella when it comes to those mental health issues that are created because of a pregnancy. So it would cover, just like there are different severities, as you were discussing, that you're treating some people with really very serious symptoms. It covers that particular instance. It's really just a mental health issue because of pregnancy. It's just easier to say postpartum depression. And we shouldn't even say postpartum because some of this kicks in before the baby's born. And strong moms, strong babies, I have to give them a shout out. They've been phenomenal, phenomenal. Really, really great help.
Hi, I'm coming from Florida and have worked in early intervention there, so I know that Pennsylvania is doing a lot, specifically in Allegheny County, so I want to echo what everyone's saying and say thank you. Before I left the state, we had a similar initiative of trying to broaden the criteria for children qualifying for early intervention services. And one of the immediate things that we ran into on the ground was not enough people to provide the services and not enough training, specifically in mental health, to be able to work with moms with substance abuse or depression. And so there were very few mental health workers on the team, and it was stressful.
Yeah.
So do you think there's any appetite at the state level to increase funding, increase training, increase education so that once the qualification is expanded, the workforce has the ability to meet the demand?
Well, I think we're at a serious lack of medical professionals and medical help here in Pennsylvania. I was just recently at an event at Duquesne University where they were revealing their new medical facility and their efforts to educate more folks. I also have a bill, Senate Bill 25, which would give nurse practitioners full autonomy after 3,600 hours and 3 years with a physician's collaborative agreement. In Pennsylvania, nurses are required, pre-pandemic they gave waivers, but pre-pandemic and today, nurse practitioners must have 2 collaborative agreements in order to work. We have got an army of very highly skilled, very highly educated, talented, capable nurse practitioners who, if they were given the ability to be independent of a collaborative agreement and work in their lane, it's only in their lane, they only in their specialty, and then refer for something that is outside of their scope, we would be able to provide really great, outstanding health care that's desperately needed. There are a lot of nurse practitioners who study in the mental health care field also, who could then operate outside of a collaborative agreement. I know recently, I think it was just a couple of years ago, there was legislation for certified social workers to be able to work independently. We're trying. We're really trying So when you are really behind the 8 ball in Pennsylvania when it comes to really good quality health care, we should be doing everything in the world we could to promote people to come into Pennsylvania, work as a healthcare provider, and we're going to support you in doing so. Thank you so much. I really appreciate your time this morning. Thank you very, very much. Thanks for all of your questions too. Thanks.